Since long before it was signed into law last Friday, politicians have been sparring over whether President Trump's big, beautiful bill is a lifeline or a death knell for the country. One significant factor is the future cut to Medicaid set to take effect in 2028. This week, state hospital leaders sounding the alarm about how that move could lead to the closure of at least some rural hospitals in Michigan. My UP's Schyler Perkins has been looking into the numbers for a look at which facilities are most at risk.
That is not an idle threat. That is exactly what will happen if these cuts are fully implemented in the years to come.
That's what the CEO of the Michigan Hospital Association had to say about the potential for rural hospitals to close or lose services if the scheduled cuts to Medicaid take place in 2028. It's a statement that left us asking which hospitals in the state are most at risk. For people in the Upper Peninsula, it's not a hypothetical, with all 14 of the region's hospitals being considered rural, and one hospital, Aspirus's emergency room in Ontonagon, shutting down last year. We reached out to Aspirus this week, and a spokesperson told us they are still working to fully grasp the cut's impact, but do not foresee any disruptions to services or facilities. And UPHS gave us a similar statement, highlighting the years they currently have to plan for any ways they might need to adapt to funding changes. For a look at the numbers, the Center for Healthcare Quality and Payment Reform collects data on hospital revenues. And last month, the organization released data showing 13 rural hospitals in the state at risk of closing, and 5 at an immediate risk. In that release, they did not share which hospitals were included, but in a data set on their website, the 7 rural hospitals in the state with the worst overall margins are in the Lower Peninsula, running a 12 to 35% deficit. Then the remaining hospitals with negative performance are mostly in the Upper Peninsula, running deficits between 0.5% and 3%. Those are Michigan Medical Center in Sault Ste. Marie, UPHS in Marquette, Aspirus Keweenaw and Iron River Hospitals, and UPHS Portage. Looking at the numbers, it appears researchers categorized those hospitals as at risk, but not immediately at risk. It's not clear yet just how much the cuts could affect the hospitals. When we reached out to Congressman Jack Bergman, Northern Michigan's representative in Washington who voted in favor of the bill, he defended the move as cracking down on waste, fraud, and abuse, adding that he fought to include the allocation of $50 billion to the Rural Hospital Stabilization Fund, a program piloted last year under the Biden administration.
Hospital closure is not an abstract concept. It's real. It's happened. And unfortunately, I think we're going to see more of that.
We'll continue to keep an eye on the outlook of medical care in the UP. For now in Marquette, I'm Schyler Perkins for My UP News.